Eslick, and I'll be doing my general head-to-toe assessment for nursing 383. First, I will wash my hands, and then I will walk into the room and introduce myself to the patient. Hi, I'm Brianna. How are you?
Good.
Right, and then first I will start with my general survey of the patient, looking at her dress, making sure it's appropriate for the weather, and looking at her hygiene, her level of consciousness, her stature, and everything looks normal there, along with her speech when I greeted her. And then I will start my assessment by inspecting the skin and nails. First, I will just be looking at the skin, looking for any lesions, the color or abnormalities at all, and seeing that her color for the skin is appropriate for her race. And then I will go ahead and palpate the skin and feel for warmth, and see if I can see any lesions, and feel for edema, and check the skin turgor and moisture, and she's off clean and dry. And then I will go ahead and inspect and feel the nail beds here, and look for any clubbing at all, and if there's any abnormalities, which those are normal. Then I will go on to check, assess the head and neck. I will just first inspect and then feel the head and the scalp here for any abnormalities or lesions there. And then I will move on to the TMJ, feeling here at the jaw, and have you open and close. And you want to feel for a clip, which there wasn't any, so that's good. I'm going to feel the temporal artery, and then I'm going to feel the frontal sinuses and the maxillary sinuses. So that's good there. I will be moving on to cranial nerve 5, which is a trigeminal nerve here. And we'll be using a cotton swab with a soft end and a sharp end. And I'll be feeling on the forehead, the cheeks, and the chin to see what the patient can feel. So tell me what you feel. Okay? All right, she got all of those right, so that's good. I'll be moving on to cranial nerve 7 now, and I will be looking at the patient's face, which is the facial nerve, and have you smile. Good. And now puff out your cheeks, and don't let me puff them out. All right, close your eyes really tight, don't let me open them. Good. Now open your eyes really wide. Good, and that all looks good there, and she has facial symmetry bilaterally, so that looks good. Next, I'm going to move on to the eyes and just inspect, so looking at the eyes, looking at the eyebrows, the eyelashes, the sclera of the eyes, there's no yellowing at all of the eyes, and pulling down and looking at the conjunctiva. So it looks good there. I'm going to move on to cranial nerve 3, 4, and 6, and I will be looking at the eyes here and have you follow my fingers. Alright, good. I'm looking for any extraocular movement, nystagmus, which there wasn't any there, so that's good. And I'm going to again use my cotton swab and do the corneal reflex here, coming in the corner of the eye and see if she'll blink. That's good and intact. Next, I'm going to be looking at her pupils with the flashlight here and see if they constrict. So just look forward, good. And then I'm going to do the concentric reflex and do the same thing with the flashlight, but we'll be looking at the other eye and see if it constricts along with the first eye. Good, so the concentric reflex is intact. Now I will be checking accommodation. I'll have you look at the snowman behind me and then look at my finger and go back and forth. Good, and her eyes were able to adjust and accommodate there. So I would say she has perla, which is pupils that are equal, round, reactive to light, and accommodation. Next, I will move on to cranial nerve 2, which is the optic nerve, and I will be checking acuity and the visual field here. We would use the Snellen chart, but since I don't have one of those, I will do it differently and have you cover one of your eyes for me. Good, and now tell me when you see my fingers in your periphery.
Here.
Okay, and again.
No.
Okay, all right, and I would do that bilaterally to check her visual field, and that looks good. Next, I will move on to the ear, and I will just be inspecting, looking at the ears here, and make sure they are symmetrical bilaterally, and then I will palpate for any tenderness and touch the auricle. And if I had an otoscope, I would be using that at this time to look inside of both ears at the tympanic membrane. Next, I'm going to be checking cranial nerve 8, which is the acoustic nerve. I'm going to do the hearing and whisper test, where I will whisper into one ear and have the patient repeat what she says to me if she hears it. Right, good, so she heard that correctly, and that is intact. I'll be moving on to the nose now, just inspecting and palpating. Inspect that it is midline and symmetrical, and palpating the bridge of the nose here. And then I'll check for nasal patency by her closing one nostril and breathing in and out. And I would do that bilaterally to check for patency. And then if I had an otoscope, which I'll just use a flashlight right now, and check for the turbinates up inside of her nostrils. So that looks good. Right, next I'm going to move on to the mouth and just be inspecting the lips, and I'll have you open, and I'll be looking at the teeth, the tongue, and the oral mucosa inside, and that all looks good. It is pink inside, and the oral mucosa is moist, so that is good. Next, I will go ahead and look for the tonsils and the uvula. So if you want to open your mouth for me and say ah, good. So she doesn't have any tonsils, so I would grade them a 0. And her uvula was symmetrical, and it went up and down when she said ah, so that is good. We'll move on to cranial nerve 9 and 10, which is the gag reflex, but we don't need to check that because she's been sitting here breathing and swallowing normally and talking to me. And the uvula, which I already checked, was symmetrical, midline there. I would move on to cranial nerve 12 now, which I will be having her stick out her tongue and then go side to side with it for me, and that's good and intact there. Next, I will be inspecting the neck here and just looking symmetrically there with the neck, and then I will be palpating the lymph nodes here. We'll start with the preauricular, the postauricular, the occipital, the tonsilary, the submaxillary, and the submental, and then the anterior cervical, posterior cervical, and then I'll have you shrug your shoulders, and I'll be checking the supraclavicular lymph nodes there, and I didn't feel any, so that is good. And then I will be checking the position of the trachea here, which is midline here, so that is good. Next I'll move to the upper extremities, and I've already inspected those, but now I'll palpate those, and palpate starting at the shoulders, going down and feeling all of the joints, and all the way down to the hands and the fingers and the joints there. And then I'll be checking range of motion of the joints, so if you could just roll your wrist for me, and then roll your arms forward, and then backwards, and then go behind your back, and then up behind your head, and then I'll have you abduct, and then abduct. And that looks good with the range of motion there. Next I'll check the strength. If you could put your arms here and push forward for me, and backwards, and now out, or sorry, in and then out. Good, and now with the wrist, just push forward on me, okay, and now back with your wrist. Good, so the strength there is equal bilaterally and strong, so it would be a 5 out of 5. Next I'm going to be checking the pulses here. I'll be checking the radial pulse, the brachial pulse, and the epitrochlear nodes, which are inside and just above the elbow there. So now I'll be moving on to the lung assessment. I'll be looking at her breathing here, just inspecting normal symmetrical breathing, and then I'll move her on to the back, and I will start with palpating here. So I'll just palpate the scapula, and then I'll palpate above here on the shoulders from the left going to the right. Just palpating for any abnormalities and going and inspecting, comparing both sides bilaterally and feeling for any tenderness there at all. After that, I'll percuss and doing that in the same manner from the upper left to the right and going side to side, listening for any abnormal sounds there and comparing them side to side. And then I will go ahead and auscultate the lung fields, and I will use the diaphragm of my stethoscope to do this. I'll start at the top left again and compare to the right and go side to side. Up here I'll be hearing bronchial vesicular sounds, and then throughout the rest of the lung fields throughout the bottom I'll be hearing vesicular sounds. Now I will go again to the front, and since I already inspected, I will start with palpating, and I will just feel from side to side, comparing both sides, any tenderness or abnormalities there, and what there isn't, so that's good. And then I will go ahead and percuss, feeling again here and listening, comparing side to side any abnormal sounds that I hear. And then finally I will be going and listening to the front of her lung sounds again with my diaphragm, and just listening up above here I'll be hearing bronchial vesicular sounds. Over the bronchi here I'll be hearing bronchial sounds, and then down throughout the rest I will be hearing vesicular sounds. And that is it for the first part of my assessment.